Let's talk about medical school. I mean, it's one of the most demanding, high-stakes environments you can possibly imagine. We're literally shaping the people who will one day hold our lives in their hands. But there's a hidden crisis happening beneath the surface of all of that intense training, a crisis of well-being that affects most of these students. So what if we could change that? What if, and this is a big what if the very system designed to test them could also be the system that strengthens them? Let's take a look at a new blueprint for building a more resilient generation of doctors.
Okay, just look at this number for a second. 70%. That is the huge percentage of medical students who have reported suffering from stress, anxiety, or depression. And we're not just talking about feeling a little overwhelmed before a big exam. This is a chronic condition with some really severe consequences, not just for the students, but for all of us, their future patients. So, here's the roadmap for this explainer. First, we're going to dig into the full scope of this medical student crisis. Then, we'll explore a pretty radical new idea. What if you could build resilience through the assessment process itself? We'll see how a framework called SAR was put into action, check out the surprising results, and then, at the end, ask a bigger question. Could this be a new blueprint for education everywhere?
All right, let's dive right into the crisis itself. Medical school is, for lack of a better word, a pressure cooker. The amount of information they have to learn is just vast. And on top of that, students are under this constant weight of high-stakes exams that are going to determine their entire careers. This kind of relentless pressure means that chronic stress isn't just common, it's practically the default setting.
And that stress, wow, it creates this devastating ripple effect. It's linked to pretty much everything from poor academic performance and even cheating to really serious health issues like sleep disorders and addiction. So here's the key point. This isn't just about how students feel. A doctor who is completely burned out during their training might develop negative attitudes that could actually threaten patient care later on down the line.
You know, for years, the solutions were kind of like putting a Band-Aid on a gaping wound. They focused on the individual student. Things like, hey, here's an optional wellness workshop, or counseling services are available. But these things often failed because they didn't get to the root of the problem, the system itself. They were treating the symptom, not the cause. And that's what led educators to search for a much more integrated, holistic solution.
And that search for a better way led to a huge shift in thinking, a real aha moment. Researchers started looking at resilience not as some fixed personality trait that you either have or you don't, but as a dynamic process, a skill that can actually be taught, fostered, and developed over time. And the definition they use here is absolutely key. See those words, dynamic process and acquired trait? That's a game changer. It means resilience isn't just about toughing it out. It's the ability to actively deal with adversity, use your resources effectively, and actually grow from the experience. It's a skill you can learn to protect your well-being when things get tough.
So this led to a pretty revolutionary question. What if the very thing that's causing all the stress, that endless cycle of tests and evaluations, could be totally redesigned to build resilience, instead of just grinding students down? This is the core idea behind a whole new approach called the Systematic Assessment for Resilience, or the SAR framework.
Now, this SAR framework isn't just one thing. It's a holistic change to the entire assessment process, and it's broken down into 5 phases. It all starts with direction, making sure students are totally clear on what's expected. Then comes preparation, giving them the tools they need to succeed both mentally and academically. Experience is all about low-stakes practice. Examiner focus actually trains the examiners on how to reduce anxiety. And finally, student reflection, which is crucial for encouraging learning and growth from the whole experience.
Okay, so a framework is a great idea, right? But it's just theory until you actually put it to the test. So a team of researchers at the University of Sharjah's College of Medicine decided to do just that, to put the SAR framework into action and see if it could really make a difference in the crazy high pressure of clinical rotations.
So what they did was set up what's called a quasi-experimental study with 149 fourth-year med students. The very first step was training all the course coordinators on how to weave the SAR guidelines into their everyday teaching. Then, they measured the students' mental health before and after the new framework was put in place.
And this diagram right here, it lays out the whole process perfectly. You can see how it was designed. It all kicked off with training the coordinators. Then, you have the intervention itself. The SAR framework was rolled out across 4 different clinical courses, and they measured students on key things like resilience, stress, and anxiety both before the courses started and then again right after they finished them. So, the big question, did it actually work? Was this big, systemic change enough to move the needle on student mental health?
Well, the results weren't just positive, they were stunning. We're talking statistically significant and, honestly, pretty dramatic.
Let's start with the 30,000-foot view. Before the SAR framework was implemented, the students had, on average, lower levels of resilience and higher levels of anxiety, depression, and stress. After the intervention, it's like the whole thing just flipped on its head. Resilience went way up, while all those key red flags for psychological distress went down.
Now let's get into the nitty-gritty. The students' average global resilience score literally jumped from about 109 to over 118. And listen, that's not just a little bump. The study confirmed this was a huge, statistically significant leap. The system itself was actively making them more resilient.
And here's the other side of that coin. As resilience shot up, all those negative indicators, they went down. The average anxiety score, for instance, dropped from over 22 to just 17. And they saw similar significant drops for depression and academic-related stress. The data is crystal clear. Changing the assessment environment directly improved the students' mental well-being. But it's not all about the numbers. The human feedback, the qualitative stuff, was just as powerful. Listen to this quote from one of the course coordinators. They said, "The framework improved the well-being of not only the students, but of the faculty too. It was creating a healthier, more supportive culture for everyone involved." So this all begs a really important question. Why did this work so well when so many other things have failed? And what does this success mean for the future of not just medical training, but maybe all education?
The secret sauce here seems to be that SAR isn't some extra, optional thing. It's not another wellness workshop students have to squeeze in. It's a holistic change that's baked right into the system. It makes building resilience just a part of daily practice. And by doing that, it shifts the entire culture from being reactive and stressful to being proactive and supportive, giving students the tools and skills they need to really thrive.
And that really brings us to the big takeaway here. Think about it. This whole study was about medical students, but the implications are massive. If we can re-engineer one of the most stressful educational environments in the world to not only measure knowledge, but to actively build human resilience, what's stopping us from applying those same principles everywhere else, from elementary schools all the way up to corporate training? Could this be the blueprint for a healthier, more effective way for all of us to learn?